Onc Live Insights is a video editorial program produced by Onc Live.
Using risk factors to identify patients who might benefit from Brentuximab Vedotin is another emerging concept, and that has been tested in a prospective fashion now in the so-called Athera study. So this is a study which specifically took those patients who have relapsed or refractory Hodgkin lymphoma and are undergoing high-dose therapy and autologous stem cell transplantation. And we know that we can identify, based on primary refractory disease, length of initial remission, and presence of extranodal disease, we can identify a group of patients who we anticipate have a higher risk of relapse after their transplant. The Athera study asked the question that if we take that group of patients, proceed with their high-dose therapy and transplant, can we then use a maintenance strategy to reduce the risk of relapse in that patient group? So the Athera study took that group of patients and randomized them between Brentuximab Vedotin, given once every 3 weeks for a total of 16 cycles, which is equivalent to a year of treatment, versus placebo. So this was a randomized double-blind study assessing whether there was a role for maintenance Brentuximab Vedotin. And the study shows a clear benefit in terms of progression-free survival, which favors patients who receive Brentuximab Vedotin. To give you an example, if we look at the IRS, so the independent response panel who reviewed the clinical information and reviewed the scans and so on in this study, then the median duration of, the median progression-free survival was about 20 months in those patients on placebo and around 40 months for those patients who received Brentuximab Vedotin. If we look at how the physicians and the investigators assessed progression-free survival, the median progression-free survival has actually not yet been reached for patients who receive Brentuximab Vedotin versus 16 months for those patients who receive placebo. So whichever group of data you look at, there's a clear and highly significant benefit in terms of delaying or preventing relapse from using this consolidation maintenance strategy.
The Federico study that was released earlier in ASCO this year aimed to look at the response rate of patients with untreated Hodgkin lymphoma, treated with BV alone for 2 cycles, followed by AVVD. That study had stage 1, 2, and 3 patients. Some had favorable and some had unfavorable risk factors. And they all got 2 cycles AVVD, a single agent, had a response assessment, then followed by AVVD to kind of consolidate that response. Interestingly, in this study, in the untreated population, Brentuximab Vedotin had a high response rate, overall response rate 87%, and a high CR rate as well, showing that even in an untreated population, Brentuximab Vedotin has a role and has a high activity rate.